Now, we have a couple of topics we want to talk to Dr. Ahluwalia about, but the truth is, we want to get to Maria and Dr. Ahluwalia, because he did the surgery last Monday.
I'm stalking Dr. Ahluwalia now, just so you know. I am obsessed with him, and so I have to sit here on the set with Dr. A. Thank you so much, by the way, for all the awesome work that you did on my knee, and we're going to get to that in a second, but I do want to talk about those interesting topics, Steve. We're talking about the flu season, and it's almost December. It's still a good idea to get your shot, but you know what? Some interesting things about the flu shot. People are turning to drugs like Tamiflu to stave off the symptoms and maybe even not get the flu shot because of this drug. What's the latest on it?
Right. So, you know, the reason we heard about Tamiflu was because of all these, the swine flu, the bird flu, all these things that were spreading across the world, and there was a fear that there was going to be a pandemic, right? That means across continents. And so we bought this medicine in stockpiles. We have like billions of dollars we spent on buying the Tamiflu, believing that if you took it, it would minimize the symptoms of the flu. But there's some new concern in Europe now that perhaps it's not as effective as we thought it was. So, you know, the British Medical Journal, which is a very prestigious journal, and the Cochrane Review, which is like an independent body that reviews literature, has really put forth to Roche, which produces this medicine.
They're saying, hey, give us the numbers, give us the data.
Give us the data, because the thing is, you know, perhaps just taking Tylenol or taking Advil is as good as taking the Tamiflu, where we are spending hundreds of dollars buying each dose.
That's really not the case then.
Well, we don't know, but what we'd like is to see all the data to really understand, because in the future there may be more of these, and we want to know what protects us. And you know, our armed forces, they carry a lot of these things, and if it's not going to work, you know, you really don't want them to be thinking that they're safe.
And again, for parents, really still a good idea to get the flu shot, right? For
Absolutely.
families.
Everybody should get it, because, you know, it's selfish not to, because if you don't get it, you're exposing other people who are more susceptible to getting the flu.
Okay, so now as a parent, teens are doing these crazy things, Dr. A. Parents, you need to really pay attention to this. Teenagers turning to the gym to build more muscle, but they're also leaning towards steroids to help them bulk up.
Right. I mean, you know, we always knew that teenagers emulate their adults, right? They have heroes, they hero worship, you know, they want to be like their idols. But what's interesting is that this is the first time we found out how prevalent this is. You know, our teens are using protein shakes, steroids, you know, creatine, all these other things.
They can just go to the store and buy this stuff?
Yeah, it's available. I mean, you know, except for the steroids, which is a little harder, but, you know, kids know how to get things. They get all kinds of things. But, you know, even like energy drinks, these are things we have to be careful of. And the problem is, you know, kids take chances. And we have to be the ones to really counsel them. The doctors have to talk to the adolescents and let them know that some of these things are dangerous.
Obviously, it's not a good idea. Some of the side effects for teens and these steroids.
Exactly, especially when they're growing. You know, you really don't want them to be exposed to these things early in life.
Parents, talk to your kids, please, about what they're doing to bulk up.
Absolutely, they should.
I want to, again, thank Dr. Ahluwalia. By the way, today he's here, and where's your doctor bag? Because he's going to take off the stitches. This is all I have to show for that little surgery that I had last Monday. I don't know if you guys...
there it is.
There it is, see? Look at that. Just
so where is that meniscus now, doctor?
What happened?
eBay.
The meniscus, yeah.
Where is it? That's right.
No, we don't have it. It's gone. It's in the pathology lab.
Okay.
But no, the surgery went really well. And
this is me right after the surgery, which lives on myfoxla.com, by the way.
Truly feeling no pain.
I'm just loving the pudding.
Eating your pudding.
Apparently. But no, the staff at Lapeer Medical Surgery Center really took great care of me and my knee.
Right.
And I'd never heard of the word meniscus until just a few weeks ago. But and I asked, how did I get this, doctor? But it's really kind of a function of, I hate to say it, but this is one of the reasons why I wear this nowadays too. It's partly age, right?
It could be multiple things. Sometimes it's just an acute injury. You twist or injure yourself in a bad way, and you know we see this in sports people all the time. Sometimes it's wear and tear. We don't like to say old. We just say wear and tear. But sometimes it happens with wear and tear, where you know the meniscus frays and it tears, and you know the symptoms are just like you had. It hurts all the time. It comes and goes, and people suffer for a while before they really get it treated. But we'd like people to know that you know it's fairly straightforward.
I tell you, I have not felt that pain. So I'm really excited to be wearing my high heels again very shortly.
Right. Doctor, tell her not to wear those stupid heels. I believe that was part of why she had a meniscus problem.
No way. No. I disagree.
I'm not going to get into that.
Smart guy. Smart guy. No,
Good for you,
you're going to
doctor.
give me the okay in a few weeks, right? And do a
Yes.
little physical therapy
Yeah.
and then
Yes.
probably be okay.
Yes.
But it's feeling really, really good.
Yeah, she's back to work in a week, which is
That's right.
amazing.
Yeah, let's
Quick
do 7 days.
return. Excellent work. Thank you, Dr.
Dr. Ray,
Ahluwalia.
thank you.
Thank you, Maria.